Hi everyone, my name is Julia Tang and I'm a physical therapist. I'm here today with some exercises to help people who may be experiencing some rotator cuff related shoulder pain. So rotator cuff related shoulder pain often presents as pain kind of in this area, right at the tip of your shoulder, and can often refer down the outside of the arm. You'll often be experiencing pain with movements like reaching overhead, reaching out to the side, in front of you, behind your back, and usually exercises or movements that are pretty quick and uncontrolled, or if you have to put a lot of force into it, those can really light up this shoulder. So these exercises are going to focus on a few things. First, we're going to target some thoracic mobility, because part of getting your arm overhead requires your thoracic spine or your upper back to move as well. So if that's not moving very well, it makes it a lot harder for the shoulder to get there. We're also going to work on some scapular mobility, because again, if your shoulder blade isn't moving as you try and lift your arm overhead or into various positions, that puts more strain on the shoulder. We're also going to be working on scapular stability, shoulder blade strength, since your shoulder is connected to your trunk through your shoulder blade here, so you want to make sure that has a nice, strong, stable base for your shoulder to move from. We're also going to work on some external rotator cuff strengthening as well, since oftentimes if you're having some pain with some of these movements here, your rotator cuff is a big stabilizer of your shoulder, and so it may be underloaded, it may be weak, or it may just not be quite coordinated enough, and so that's giving you some pain here. So as always, you should follow the recommendations of your physical therapist, since they'll have a tailored program just for you, but these are some exercises which may help. As you can see, I've got quite a bit of equipment here. So I've got a foam roller. This will be used for the thoracic mobility as well as one of the rotator cuff strengthening exercises. I've got a couple bands. One is long for some rows, and then one is more of a loop. And I've got a lacrosse ball here. You can also use a tennis ball. A lacrosse ball is a little more aggressive, but you can also use a tennis ball for some mobilization of those muscles that we're going to do. And I have a weight. This is for the rows. It doesn't have to be super heavy. You can use like a sack of rice, books in a book bag, things like that. It doesn't have to be a super heavy weight. I've got about 8 pounds here. And then also I have a bench. You can use a chair, couch, anything that's about knee height. You can use your bed. So lots of options for that, okay? So first thing, I want you to try out one of those movements that are a little bit painful, and then compare to after you're done with these exercises and see if that movement is a little bit less painful. But other than that, gather your equipment here and let's get these exercises started. Okay, so first you're going to grab your ball. This can be a tennis ball, and a lacrosse ball is pretty aggressive. So if you're just starting out, just use a tennis ball. And you're going to put it I'm going to use my right shoulder as an example of a painful one today. So just put it kind of between your shoulder blade and your spine here. And then you're just going to lean up against a wall, and you can put as much or as little pressure as you want. And then gently roll up and down. Just try and release those muscles. You can also pin it in one spot and slowly move your arm back and forth if that's comfortable, or up and down if that's comfortable. If anything throughout these exercises is painful, just reduce the range or use less pressure or less strong of an effort. But the goal of this is to kind of calm down your shoulder here. So for about a minute, 30 seconds to a minute, we'll just kind of work into the muscles in the back of the shoulder. You can go side to side, up and down. That's my ankle popping. But just kind of explore. You might find some kind of tender spots, and so you can gently sink into those. And then once you've kind of loosened up the muscles in the back of the shoulder, go ahead and grab that ball, and you're going to put it in your pec muscles, so right between your shoulder and your chest here. Lean up against the wall, and again, kind of roll up and down. Oftentimes, if your shoulder gets stuck forward, it's getting pulled by the pecs. We just need to release those pecs a little bit to allow the shoulder to get into a little bit better position farther back. So again, you can go kind of side to side along those pec muscles, feel the tender spots. Just kind of sink in here, and you can also, can't really see it on this arm, but you can pin the ball next to the wall and then move your arm backwards or kind of do like an angel motion here. Just as high as you can, just try and release that pec. Okay, so hopefully now we've gotten those muscles a little bit less cranky. So now we're going to move to our foam rolling thoracic mobility exercises. Put this off to the side. So the first one is going to be on the ground, thoracic extension over the foam roller. So you're going to set it up so the roller is just a little bit below your shoulder blades. Hips are on the ground. Put your hands behind your head. If this is painful, then you can keep your hand across your chest, but just try and gently ease it up into this position. So abs are tight, so your lower back is stable. You're gonna lean back over the roller and then come back up. So try and just lean backwards, extending through the upper back. So lean back, come back up, lean back, come back up. Go a few times, and then you're gonna walk yourself down the roller. Lean back, come back up, lean back, come back up. Just a few times in each spot. So walk yourself down the roller. You should start about just below your shoulder blades, and you can finish right below the base of your neck. So we're just really mobilizing through the whole upper back right now. Maybe one more here, a few more lean back. And if it feels good, you can also just push yourself, roll up and down the roller, get a little bit of self-massage to those muscles on either side of your spine here. And then I'll have you sit up. So you're going to roll to the side, sit up. And we'll put the roller off to the side here. And now we're going to move into a child's pose thoracic rotation. So you're going to set up, sitting all the way on your heels. Put your elbows in front of your knee. And then you're just going to put your hand, doesn't have to be really far behind your back. You can just put it right behind your hip here. And then try and peel back the shoulder blade and rotate up through the thoracic spine here. So we'll go about 10 times here. That's 3, 4, 5. If that's really too painful, you can try putting your hand behind your neck or your head here. But if you can, I would keep your arm a little bit lower. 7, 8, 9, and 10. Okay, so then we are going to go to the other side, even though it's just one shoulder, but we want to mobilize your thoracic spine both ways. So again, sit on your heels, elbows right in front of knees. Place that hand low behind your hip, and then peel the shoulder blade back, then rotate up. That's 1, 2, 3. Only go as far up as is comfortable. 4, 5. Make sure you're breathing. 6, 7, 8, 9, 10. Good. And the last thoracic mobility exercise here is going to be thread the needle. So the full version is reaching up and then reaching through. However, the reaching up part may be a little bit too much at this point. So you're just going to reach out to the side and then thread your arm through. And we're going to alternate sides here. So the goal, you're going to reach out, reach your arm through. The goal is to get the back of your shoulder and the back of your head all the way on the ground. And so here, you can either alternate back and forth. I'm just going to go about 10 times here. Or if it feels good, as you're reaching through, you can hold this position here for a couple breaths and then switch. This is 5 here. We'll go for about 10. And 6. Make sure to keep nice, steady breathing. 7. 8. 9. One more to the other side. And 10. And you can always pause the video and do any of these exercises for a little bit longer if those feel really good. So now we've kind of mobilized through our thoracic spine, so now we're going to work on a little bit of scapular mobility and strengthening here. Okay, so our next few exercises are going to be a prone I, a quadruple protraction and retraction, and then a sideline shoulder external rotation. So we'll go in a little bit of a circuit here. So for the prone I, you're going to lay on your stomach. So tuck your chin slightly, make the back of your neck nice and long. Palms are going to face in down by your sides. Then you're just going to peel your shoulder blades back. Squeeze those shoulder blades together without shrugging up towards your ears. And we'll do 10 here. So we'll go 10, 9, pretend there's a mosquito between your shoulder blades. 8, and you're trying to kill it. 7, kill the mosquito. 6, 5, 4, squeeze those shoulders together. 3, 2, 1. Good. So now you're going to gently come up into all fours, and we're going to do a quadruple protraction retraction. So you're going to sink your chest towards the ground and then push away, rounding out the back. So you're just trying to get as much motion through the shoulder blade as you can while still staying in that comfortable range. So if it starts to strain your shoulder or if it's painful, just reduce the range. But here we're getting a little bit more shoulder blade mobility, as well as working the serratus anterior, which is your punching muscle. It's really important for swinging your shoulder blade up, out, and around to help you get your arm overhead. I think that's 6. Do about 10 here. 7. Inhale down. Exhale up. 8. 9. And 10. All right, so then the last one in this circuit is going to be a sideline external rotation. So since I'm saying that my right arm is the problem arm, I'm going to lay on my side with the right side up. So you're just going to put your elbow right next to your side. If it helps, you can put a little towel roll here to keep your elbow right there. And then you can have a pillow or support your hand with your head. You're just going to rotate the back of your hand towards the ceiling. If this is too easy, you can grab a really light weight here, just like 1 or 2 pounds. So I'm just going to do the first round body weight, and I'll try the second round with a little bit of weight. And we'll do 15 here. 5, 6, 7, 8. So keep peeling that shoulder blade back. 9, and make sure your shoulder isn't hiked towards your ear. 10. And again, you can always shorten the range if it's too painful, so you can just stay in this small range here. 13, or all of the full range here. 14, and 15. And if this is too painful, you can always stop before all 15 reps are done. Just kind of go at your own pace here, okay? So now we're going back to those prone eyes. So I'll show you from the front here. So face down, head straight down, and we're going for 10. Squeeze those shoulder blades together for 1, 2. You can leave your hands on the ground or lift them off slightly. 4, 5, 6. Keep the back of your neck nice and long. 7. Kill the mosquito between your shoulder blades. 8, 9, and 10. Okay, so then come back up to that all fours position for the scapular protraction retraction. So sink your chest between your shoulder blades, and then push up, round it out, and then just keep going back and forth. Inhale down, exhale up. So you're really trying to get a lot of motion here. So inhale, sink the chest down. Exhale, push the ground away. If this is too much pressure, you can also sink back onto your heels and do slightly less weight on your hands here. You can also try and go against a wall. Do it that way. I think that's 9. This is 10. All right, so then we're gonna go again for the side lying external rotation on the ground. Oh, and this time I'll use a small weight. This is just 2 pounds, so 1 or 2 pounds. It can be a soup can, can of beans, pasta sauce, anything like that, pretty small. Then we're gonna go for 15. 1, 2, 3, 4. Keep that elbow right next to your side. 5. Shoulder blades sliding back. 6. Only go in the range that's comfortable for you. 7, 8, 9, 10. And remember, you can stop at any time if the reps get too many. If the weight gets too heavy, just put it down. 13, 14, and 15. Good. Okay, so now we're going to go towards a little bit more shoulder blade strengthening, and rotator cuff strengthening. But this one you'll need your band, a wall, your foam roller, and a bench. So kind of gather those things here. Okay, so for our last round of exercises here, we're going to do banded rows and then a foam roller, wall roll with external rotation. We'll do unilateral rolls using the weight and the bench here. Then we're going to do bilateral banded external rotation. So the first one is going to be those banded rows. Take your long band. You can either throw this around like a stairwell post or put it around the door handle in the door. Make sure you're not covering the door latch. Close the door and then give it a nice tug to make sure it's secure. So grab the band and then we're going to pretend like that mosquito's between your shoulder blades again, keeping your forearms parallel to the ground. Drive those shoulder blades back, and you can see I have a split stance here just to help keep my balance. So you want tension on the band the whole time. And I'm going to do about 15 here, but you can always stop earlier if that's too many. So that was 5, 6. Make sure you're not shrugging your shoulders up. 7. Really drive those elbows back. Peel your shoulder blades back and together. Squeeze the mosquito. Kill that mosquito. That's 10. 11. 12. Kind of puff your chest out here. 13. 14. And 15. All right, so then we're going to come to the wall. So you'll need that loop. Setting this up is the hardest part. So get that foam roller on the wall at about your chest height here. And you're going to have some tension on the band, and then you're going to roll the foam roller up the wall. So, and you can make it harder by stepping farther away from the wall, getting a little bit more core activation and more serratus press here. So I'll start standing pretty vertical here. So pull apart on the band, and we'll do 10 rolls up and down. That's 1, 2, and you may be able to get higher overhead. 3, 4, or you might stay in a smaller range depending on how your shoulder's feeling today. 6, 7, 8. Keep the tension pulling apart on that loop. 9, 10. Good. All right, I feel a little bit of a burn in my rotator cuff there. So then we're going to come to these unilateral rows. So you'll put your knee and your hand on the bench or the chair, whatever you've got. Make sure your back is in neutral. You don't want to be arched up or rounded up or overly arched down. So head and back in neutral. You're going to push into the bench with this stabilizing hand here, and then drive that elbow up towards the ceiling. So it's not a bicep curl. The elbow is going to peel, your shoulder blade is going to peel back. Elbow is going to drive up towards the ceiling. So we're doing 10 here. And that's 3, 4, 5, 6. Remember, you can always do more or less depending on how your shoulder's feeling. 8, 9, and 10. Okay, so we'll switch to the other side. So make sure to push into the bench here to stabilize your shoulder and stabilize your back, and then peel that shoulder blade back and drive the elbow up. for 1, 2, make sure not to shrug up towards your ear, 3, kill the mosquito on your back, it's still there, 4, 5, 6, 7, 8, 9, 10. Okay, so now you can either take this single band out of the door for your rows, or you can use the loop here. I think I'll use the loop. So you're just going to have your palms facing in, holding the band, and then you're just going to rotate both your hands out to the outside. So if it's a pretty stiff band, you probably won't have a ton of motion, but again, you're working on squeezing your shoulder blades together as you rotate out. And this will do about 10 here. That's 3, I think, 4, and you can always do a smaller range of motion, 5, 6, 7, 8, 9, try and always have just a little bit of tension on the band, and that's 10. Okay, so going back to the banded rows here. So get your nice balanced stance and get ready to kill that mosquito between your shoulder blades and peel those shoulder blades back for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep your forearms parallel to the ground. Again, it's not a bicep curl. 11, 12, squeeze those shoulder blades together. 13, 14, 15. Very nice. All right. So next one, we're coming back to the wall here. So if you want a little bit more of a challenge, you can try and put the foam roller a little higher up, so you're rolling it a little higher overhead. But if that's not for you today, also totally fine. The setup is the hardest part of this exercise. So you're gonna get some tension on the band, pull apart on it a little, and then roll up the wall for 1, 2, 3, always be pulling apart on that loop here, 4, 5, 6, 7, 8, 9, and 10. Good. All right, let that down. We're coming back to those unilateral rows, so grab your weight, set up your nice neutral spine position here, and squeeze that shoulder blade back, drag the elbow up. For 1, 2, you can always lower the weight or increase it if it's either too much or not enough. 5, 6, 7, slide that shoulder blade back. 8, 9, and 10. All right, we're switching to the other side. Make sure to keep your neck nice and long here, head neutral, drive it up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Very nice. Okay, so we're going to finish with the external rotation, so I'll use my longer band this time. So you can loop the band around, but make sure your thumbs are facing up, palms are facing in, and you're just going to glue your elbows to your sides and rotate out. So we'll do 1, 2, 3, 4, 5, we'll do 10 here, 6, and again you can do a smaller range of motion if you can't do that wide. 7, 8, squeeze the shoulder blades together, 9, and 10. If you want to do more, if that wasn't enough reps, you can always do more here, but that was it for those exercises. So I want you to retry that motion that was painful initially and see if it's gotten any better. So hopefully it has, and so hopefully these exercises were helpful for you, and thanks for watching.